Do you know surgery on the blood vessels of your body is one of the most delicate and specialized work that a surgeon can do? Today we will talk just about that, vascular surgery. Some people get confused or nervous because they have heard of surgeries of the brain, the heart, and they think they are very major. But very few people would have heard about surgery being done for your arteries and veins of the body. So today I will tell you about what we as vascular surgeons do, and we will bust some common myths around vascular surgery. Hi, I am Dr. Sumit Kapadia, a vascular surgeon with more than 18 years of experience and having treated more than 10,000 patients with different vascular problems. The first and common myth is that vascular surgery is only for the elderly or senior people. A lot of people think that vascular diseases are going to be more common in elderly age groups. So why should we at our age be worried? But let me tell you a fact. Similar to what India is seeing, the incidence of problems of heart are now seen in so many young people. And we also see lot of young people with different artery and vein problems who come to us, sometimes very shocked about why they developed this problem in the first stage. An interesting study published in our own Indian Journal of Vascular and Endovascular Surgery showed that almost 30% of people or patients with peripheral arterial disease were less than 50 years of age. Now this is Indian statistics, not something taken from abroad. And to give you an example, let me tell you about Raj, a 42-year-old software engineer, busy enough in his work, but so busy that he couldn't pay attention to his diet or his exercise, sitting all day long on a desk, looking at the computer, not moving around, eating fast foods, skipping meals. One day he had pain in the leg, which got aggravated in a couple of days, and he was clueless about what it could be. Finally, after 5 days of severe pain, he was diagnosed to have a blood clot in his leg artery. And one of the primary reasons would have been his inability to walk or eat proper food or exercise. So, my dear friends, vascular disease can also strike you when you are young, especially if you're not careful. And this is just a warning sign. Sitting is the new age smoking. So for people who think smoking is bad, sitting can be bad too. Coming to myth number 2 is that surgery is required for all vascular problems. Now this is a big myth. Many people think that once they visit a vascular specialist, all we will do is recommend surgery or interventions. But I have already said this in my earlier videos, more than 70% of the patients who come to us, we advise for simple changes with maybe lifestyle, diet, exercise, physiotherapy, and just taking good care of yourself. Most of the people do not require surgery or intervention. Let's give you the example of Anita, a 55-year-old busy housewife who wanted treatment for her varicose veins. Did a research on her own that she had varicose veins and she believed that her problem is due to varicose veins. She took an online consultation. She flew down to Baroda to get herself evaluated. We did some further tests, including Doppler, and what I recommended her was really surprising for her as well. She had come prepared to get the varicose veins operated by me, but her major problem and symptoms were due to muscle pain and vitamin deficiency. So, with just good dietary care, a few medicines, and incorporating exercises in her daily routine, she was much better in a month, and we could avoid surgery, laser or glue in her case. So even if surgery or intervention is required, it is fairly safe to do so. The minimally invasive endovascular procedures that we do are fairly good, effective, and they have faster recovery. So major surgery is required in very less patients who have vascular problems. In fact, a 2022 report in the European Journal of Vascular and Endovascular Surgery showed that out of all the patients treated for vascular problems, almost 50% of these procedures have now shifted from open surgery to minimally invasive endovascular methods. and India is not far behind. This third myth related to varicose veins is something that I hear very commonly, and that's varicose veins is just a cosmetic problem. So a lot of people end up thinking that varicose veins is only seen, it will not give any problems. But we see too many people, patients who have neglected varicose veins and end up with problems, complications, including ulcer, bleeding, skin changes, swelling, pain, and then they repent about why they waited so long. A 2018 study in the British Journal of Surgery, a reputed journal, showed that the incidence of varicose vein ulcer in untreated varicose veins is almost as high as 40%. So if you have varicose veins and you see certain skin changes, don't wait for problems to occur. Take charge of your varicose veins and get them treated in time. The fourth myth is related to diabetic foot. People who have diabetes often have this myth that once they have a foot infection means they are going to lose their limbs. For diabetic patients, it is often observed that major amputations, the starting point is usually a small toe ulcer or gangrene. And if that is aggravated, that can end up with an amputation almost at the knee or sometimes even above the knee level. But according to the American Diabetes Association guidelines, 85% of amputations in diabetics are preventable with proper care. Here I'll tell you about Mr. Ramesh, a 63-year-old teacher from Bharuch, educated enough to realize that problems need to have a scientific basis. Now he had a foot ulcer. He was a diabetic for quite some time, but he developed a foot ulcer, kept on going with regular dressings, and the doctors there found that the ulcer is really aggravating. It had gone almost up to the bone, and a few of his toes also had to be amputated. But still, the wound was not healing. That's when he was diagnosed to have peripheral arterial disease or low blood flow in his legs due to diabetes. Most of the doctors there recommended to go ahead with a below-knee amputation and solve the problem. He came to us, we did an angioplasty, used advanced wound healing methods like hyperbaric oxygen, VAC therapy, and in a matter of 2 to 3 months, he was back on his own feet. Yes, he had lost all the toes, and he's still active and continues to walk and do his daily routines on his own. So diabetes, remember, can affect the circulation, but the earlier it is detected, the better it is treated. The fifth myth is that vascular surgery is always painful. One of the biggest fears that people have is that any major vascular surgery would be painful and unbearable. For those who have rest pain and gangrene, the pain of the disease is much worse than the pain of the surgery. And apart from surgery, as I said, 50% of the procedures and treatments and interventions done are minimally invasive and endovascular. So there, the chances of pain are very, very less. The recovery also is quite fast. Most of the patients who undergo angioplasty, stent placement, laser, glue treatment are out of the hospital by the second day, and they can resume their daily routine activities in a matter of days. I had a patient, Mrs. Kapoor, 73-year-old grandmother from Surat, who, despite her age, was quite active, but she developed a small toe ulcer and gangrene, which kept giving her pain. She was scared of undergoing any surgery. We convinced her that the treatment will pain much less than her original problem. And after undergoing a simple balloon angioplasty, she found good relief in her pain and was very thankful to us. So remember friends, misinformation can be dangerous. The word vascular surgery may seem scary, but it is not so difficult if you understand it properly. And for people who want to get treated for their vascular diseases, go to a vascular surgeon or a vascular specialist who will give you the complete range of treatment. And for those of you who are looking for more authentic information about peripheral arterial disease and how we as vascular surgeons treat it, this video will give you the information you desire.